Everybody, welcome to our Q1 membership meeting. We are just going to quickly introduce ourselves. My name is Alicia Miller. I am our president for this year, and I also have Olivia on, who is our past president. Madison is our president-elect, but she was unable to make it with us today, but she has been part of our presidential team. But we are going to be going over a little bit more about what we've been doing this year and a little bit more about our membership. And then this will all be uploaded to our website and be sent out in our monthly newsletter so everybody can access it. So far with our membership, we have 113 active members. We have within that 73 child life specialists, 1 child life associate. We have 3 educators and 36 students. New this year, we will be adding a membership directory, and this will be sent out to our members and will also be available on our website. And then at the very bottom, we have our link that you guys can click on to share to other people to become a member if you have not been a member already.
We want to share a little bit about our financial health and where we stand. We've had a lot of questions over the years. We've had a lot of questions ourselves too, trying to figure out what really makes our bank accounts tick, really where this money comes in and out, how we can function the best as an organization. So last year after conference, our executive board decided it would be imperative to meet as a group in person to discuss kind of where the finances stand, what we need to do, changes that we need to make. So we did a lot of idea sharing. And then we, as a presidential team, actually met with a financial advisor to figure out the best method moving forward so that we can maintain a good, healthy bank account, but also ensuring that we are being fair and equitable with our membership as well, and giving everything that we can to you for the lowest price possible. So we did identify some financial gaps as we did speak to the financial advisor. So we are working on those things actively, and we actually reorganized the yearly budget this year. If you notice, we were able to lower professional membership rate fees, and we also have some other things in store for this year for saving money on your end, and hopefully we plan to keep that for long term. We're still figuring out all of the ins and outs, but exciting updates to come. Additionally, we are just looking forward to figuring out what else we are going to learn from the financial advisors moving forward.
As for the additional programs that we have been offering this year, we have our mentor-mentee program. There are a couple of different ways that we have added to our mentor-mentee program. You can, if you do sign up to be a mentor or a mentee, we will match you up to whoever that is of who you want to be with. So that could be a new child life specialist that wants to be with a seasoned child life specialist, a student with a child life specialist, a student with a student, different matches that we can work with. So far, we have 4 members that have all been matched, and so far they have been all certified child life specialists with a student to be mentored by our child life specialist. Along with that, we have our Sunshine Surprise that has finished in the month of March. We have 8 members that were a part of this program and were matched with each other. It was just a little way to give back to each other, and you were matched up with someone and sending them a little surprise for Child Life Month, which was really fun for our members. And then we have 2 different webinars that we have coming up. One is for Ask an Expert. Our next Ask an Expert series will be in April. We do not have a specific date as of right now, but it will be performed by Katrina Froh, and she will be talking about professionalism, networking, and making yourself a little bit more marketable. So you will see on our social media and on our website ways to sign up for that if you want to be a part of Ask an Expert. And then our next webinar will be April 22nd, so that is coming up quickly. That will be at 3 p.m. and it will be an ethics domain if you need that PDU.
We are off to a great start with scholarships for this year. We have already started awarding our student internship and pre-internship scholarships. We offered 2 internship scholarships this year for the first semester for summer, and then we also offered a pre-internship. Our spring and winter internship students have already been awarded for the year as well, but we just finished our applications for the summer ones. So we're excited to announce those winners here very shortly in the coming weeks. We are going to be opening the next round of scholarships soon, right around May after ACLP deadlines close up for internships. We are also excited to bring back scholarships for conference this year. We're hoping to increase what we've been doing in the past, but also just continue to offer our community everything that we can from the organization. So stay tuned on more information for that as we get closer to conference.
Speaking of conference, this year our conference and student symposium will be combined instead of doing 2 separate events, and it will stay that way moving forward. But this year it will be held on October 3rd and 4th at Metro Health Medical Center in Cleveland, Ohio. Metro Health is very, very excited about this year to host as we are celebrating a couple anniversaries. It will be our 15-year anniversary for GLACLP, and then we are celebrating 70 years of Emma Plank starting their program there at Metro Health. So all things to come with conference. We will, like I said, have a student track for our students, so that will be specifically designed and tailored to help out our students. This is still all work in progress, so please keep a lookout for details on what the student track will look like, and then along with our brochure for our conference that will have all of our speakers and PDUs that will be offered. As of right now, we have our call for abstracts open. They are going to be due May 30th by 5 p.m. But on our social media and on our website, you can find on how to submit an abstract if you or any of your colleagues are interested. And then we have the link here that will push you forward to where the link is to apply and submit an abstract if you would like to present on our conference. But we are very excited about this year. It will most likely be held in person, so we are excited to do a lot of networking, as this was one of the biggest things that we got from feedback from conference last year. So we are working really hard on finding different ways to network as professionals, for students, all that stuff. So keep a lookout on different details for that to come. So like I kind of stated with conference, we really wanted to listen to our members and kind of revamp on what we do and make it the best we can. So we really wanted to focus on our members this year, with it being an anniversary, but also just showing how much we do care about you guys and appreciate you guys. So we are going to be doing a membership gift for everybody. This will be sent out via email and our website and our newsletter. So this will be something that will be coming moving forward. So keep a lookout on that. And then for our e-board, we will be having nominations open this summer. We have a couple positions that will be open, including our president-elect position, treasurer, the secretary, a traditional child life specialist at large, a student member at large, and then a CLA member at large. So if you guys are more than welcome to nominate yourselves or nominate another person, and that link will be sent out once we get closer to the summer. As for websites, we have been revamping our new website. We had a lot of feedback on just problems with links and just the management of things and how to navigate our website. So we took the time to just completely wipe our last website and make a new one. And this will hopefully accommodate a lot of our new members and make it more user friendly. We updated a lot of different information that was on there, including working on updating hospital contacts and regional opportunities for not only professionals but students as well. And then also with our website and everything in general, we have transitioned from Google to a Microsoft platform. So everything on our website should be through a Microsoft link and not a Google link. Since a lot of hospitals have been cracking down on securities, Google has not been very friendly and user-friendly to everybody at hospitals. So we did a total revamp and took all of our things and documents and emails, changed over to Microsoft Teams. So that is where a lot of our webinars and meetings and things like that will be going through. And then we have all of our new emails and everything that will all be listed on our website as well. So if you do need those emails and stuff, that is all on there. But we also have, since it is a transition year, if you do happen to email our Google emails, it will automatically be transferred over to our Microsoft email. So we will still get it. So you don't need to worry about that. And then that is really all we have for you guys. Olivia, is there anything that you have to add?
Nope. Let us know what you need from us. We're really here to support you. We want to make this organization better and better. We're doing our best. So please don't steer away from feedback. We're doing our best to implement everything that you've told us since we've been on the board. Just keep us in the loop of what you need.
And then we have the main president email through Microsoft Teams linked here. So this was our main contact. So if you guys need anything or have questions or do have input on how we can appreciate you guys and make things better, please let us know. Thank you.
Thank you.